Thank you both for being here and for speaking about your remarkable work. And I have to say that in so many ways, when the judges and I were watching it, it's remarkable to think about the decisions that you all made at the outset, the ambitiousness of the project. So I'm wondering if you could talk a little bit about what it was like to conceive of this kind of a project back a year ago, back when we had a very different understanding of the pandemic.
We knew that CBS News wanted to do something big on this. There was a flurry, a regular drumbeat of media coverage at the time. The pandemic had exploded. Um, we wanted to put our mark. We wanted to do it in prime time. We weren't sure what to do right off the bat. We spoke about it again and again. We thought about having correspondents fan out across the country. Um, and we at the same time though consciously wanted to avoid a sameness, a repetition of the kind of coverage that had been out there. So we thought, how can we go narrow and deep? What can we do that can differentiate us, CBS News, from all the other coverage and make it worthy of a primetime documentary special? And that was the beginning of the conversation that helped shape where we ultimately went.
The two words that kept coming up again and again, Gordon, was additive and distinctive. We wanted to make sure that whatever we did was additive and distinctive from the other coverage that was on TV continuously in those early months of the pandemic.
That's remarkable to think about it being because it is clearly distinctive. And I guess one of the things that stands out is the need for a partner, the need for a health community to provide the kind of access. Because as the health protocols were evolving and developing, this certainly had to be high risk and stressful, just even for the discussion of your teams and crews. So, can you talk a little bit about the decision making, both about identifying a partner and then working with your teams to communicate and work through who would go in? And maybe, Guy, you want to start?
The first challenge was finding a large medical institution in the New York City area that would allow us to spend the whole week with them. There's a host of concerns that comes along with that. First, safety. You are in the middle of a pandemic, a deadly disease is raging. And second, there's a host of legal and privacy considerations that American medical institutions face every single day. So we had to work that out as well. You just can't walk into a hospital and start rolling for no other reason that there are federal laws against that, federal protections of privacy. So we had to work very carefully, ultimately with Montefiore Medical Center, about how we're going to go about doing that. And really the credit goes to Mitch, because Mitch is a dynamic negotiator. And Mitch spent a lot of time speaking with Montefiore's people about what we wanted to do and why it would be in their interest to work with us together on this.
On that note, I would say, we shot this, our week-long experience on the most critical wards happened at Montefiore Hospital with the Montefiore Medical System. And we have to acknowledge what an act of faith that was on their part. It came after extensive negotiations. It would have been very easy for them to say, sounds fascinating, but we're not interested, as other hospitals did. But they were intrigued by the conversation. They engaged the conversation. They had 100 questions, and we went back and forth, and we developed a level of trust. But it was an enormous leap in many ways on their part at their most vulnerable time in the midst of tremendous upheaval. So I think really impressive on their part that they decided to undertake this.
And Mitch, to that point, when your initial comment, you described the challenge of making sure there was a depth of the coverage to not just give it a uniformity. As someone who grew up in New Jersey, the Montefiore Medical System is obviously has a tremendous reputation, but it's also significant in the role that it plays in the city. Can you talk a little bit about what it meant for the depth of having that hospital facility and those wards made available and visible to news consumers?
Right. So our story was different because we wound up at Montefiore Hospital, because we wound up in the Bronx. We were really able to take maximum advantage of a key editorial aspect of the COVID crisis, which was and is the tremendous racial disparity that we see in the exposure rates, in the results, in the outcomes of these patients. And so if we had shot at other hospitals in Manhattan, on Long Island, in New Jersey, other places that we had discussions with, um, we might have had a different editorial foundation, a different experience. But we were in the Bronx. We were in New York City, which had the highest COVID rate in the country, in the Bronx, which had the highest COVID rate of the 5 boroughs of New York City, at the most critical time. When we started shooting, the New York City was seeing about 800 COVID deaths a day. It's almost hard to think back to that, to the beginning of the crisis. It was staggering. And we really saw, we were really able to dive deep on that aspect of the racial disparity and make it an important part of our documentary.
Remarkable. And so you have the negotiations, the 100 questions or more to get access and to get that engagement. And in your notes describing the presentation, there's a discussion about the work that goes in, the care that goes into working with your reporters, with your camera teams, to quite literally describe what the risks they're going to be taking. So I'm wondering if you could talk a little bit about the discussions you had with your reporters about their effort to both be there to document for the viewers, but with also trying to manage and mitigate their own personal health risks.
Well, I'd like to start on that and then turn it over to Guy. So that really is that conversation. That part of it is about four of our people, most centrally, Guy Campanile, Andy Bast, Gilad Thaler, and Sean Herbert, who each made that very brave decision to go into the hospital. And Guy was there with the team in the hospital, leading that team, and he could tell you more about that.
One of the things that happened here, Gordon, is we kind of felt it was important to keep our profile extremely small, our footprint small, because of the risk that was involved here. And we had to make sure the people who were going into the hospital fully understood those risks and did so voluntarily. I will tell you that the 3 other CBS News producers who I spent time with in the hospital for a week, as well as our 2 technical people who were with us, Danny Levy and Holden Frandino, who were outside the hospital feeding material and logging things. They're not just colleagues, they're friends. So there was a level of trust here. I can tell you, I've traveled the world with Andy Bast. I've known Sean Herbert for a better part of 30 years. And Gilad Thaler is one of the brightest, smartest, talented young producers in broadcast television. So we kind of looked at it as almost as a special forces SEAL Team 6 approach. Like, keep it small, keep it stealthy, keep it moving. But safety had to be the number one concern. And we insisted with each other to keep ourselves at distance all the time, wearing masks all the time. If someone got lazy about decontamination protocols, the other 3 of us started yelling at him. It was that tense sometimes, but the payoff was that somehow fortune smiled on us. And even though we were in the middle of it, none of us got sick. And that goes a long way to the kind of watching each other's backs, and also the great care the folks at Montefiore took in, training us properly the days preceding our entry into the hospital and keeping us honest to the proper protocols for safety.
It's remarkable, and it speaks a lot to what you're saying too, of the lack of knowledge that we had proportionally at that time, and so the abundance of care that was necessary, the notion of decontamination. That's at a time when many Americans were sanitizing their bags from their groceries having delivered because we just didn't know. One of the many remarkable things about this work is the way that it reads as a first draft of history, and a draft of where people trying to understand what's taking place. Given the context of being there and seeing that, is there anything that you would want to share with the folks watching the awards ceremony or watching the awards program to really give an insight beyond what we saw on the screen about what the experience was, and maybe years from now when the moment is further detached? Is there any kind of a sensory or particular experience maybe you could share about just what it meant to be there at that first draft of this history?
Yeah, I'll tell you, the striking thing, Gordon, over those 5 days was the selflessness of the medical personnel that we spent time with. Now, that sounds kind of cliche, they're heroes and so forth. I think this extends beyond heroism. because of the uncertainty that surrounded the disease at that time, because of the danger, the number of people we were with who within hours had tested positive after we'd spent time with them and then got ill. These doctors, nurses, technicians, janitors, food preparers, everyone at that hospital, and administrative staff, they not only were at risk of themselves, but these people went home at night and their families were at risk. I mean, that's what was so different about this experience. We all of us involved in the project at one time or another have gone to places in the world that were dangerous. It could be a war zone or a natural disaster, right? But when it was over, you got on the airplane, you came home, right? You were safe. This experience was different because the enemy was inside the wire and you were surrounded at all times. And it was just spooky. It was just really spooky because you just didn't know during it. And when it was over, for the 2 weeks we were all in isolation individually, would we get sick? And if we got sick, how sick would we get? And were the people we were with, did they get sick? That was something that I think will stick with me forever, is the kind of lingering uncertainty even after we stopped rolling.
I'd like to add something to that, Gordon, which is, given everything Guy just said and the tremendous risk they undertook, in the same way it would have been easy for the hospital, Montefiore, to say, let's not do this, it would have been pretty easy for CBS News to say, maybe we shouldn't do this. Let's just give hospital personnel some cameras and we'll take the footage back and make a program out of it. But we had tremendous backing and support from the beginning from our boss, Susan Zirinsky, who of course is not just, was not just an executive and president of the news division, but also a deeply experienced producer. And there was faith on her part and confidence and encouragement on her part to have us do this, to take a calculated risk. And it was very fraught and there were a lot of conversations, but she gave us the green light, and she's a big part of the reason why it all worked.
Thank you, Mitch. That's a great reference because that obvious, so that you have the footage, you completed the program, and Guy, thankfully, to your point, that it seems like from the information that we have, the team came out of it and were in good shape from that experience. When you start seeing this compiled work and going through the editing and the review of it, from a jury now, it's striking in its urgency. It's striking in the humanity and the reaction. Mitch, I'm curious for your team and the kind of the folks that were watching this being edited and put together. Did you have that same sense of this is something truly remarkable that we'll be looking at years from now?
I was gripped by it every day. I had a little bit of distance, a little bit of fresh eyes. Guy and the rest of the team were inside the hospital, living this all day. And I had the benefit from the armchair of sitting back and watching it come in. And I found it staggering. We, as news producers, as journalists, you always want that unfiltered view. You don't want the public affairs staff hovering over you, limiting what you can see. And we found them tremendously agreeable. As long as we respected patients' privacy and stayed out of the doctor's way, what I saw of Guy and the rest of our team that was inside the hospital is that they were given tremendous latitude to move about, to film respectfully. And so we had that real cinema verite, that fly on the wall experience in the most intense moments, in the most dramatic instances, watching the doctors and nurses themselves try and figure out this mysterious virus. And it was fascinating.
Wow. And Guy, from that perspective, from being there and seeing that, I mean, I know you described that kind of that notion of unending, which the work does a great deal to kind of engage the temporal nature that it does. It's constant and it's ongoing. Did you feel when you were starting to see it come together that it really was capturing that sense of just the degree of trauma for everyone involved?
Yeah, absolutely. I mean, even before we were getting the material uploaded to our colleagues who are working around the tri-state area in their own dining rooms and living rooms to build this hour, right? We would watch what we shot within minutes together. the four of us in our workspace at the hospital, and I was talking to Mitch almost continuously, and I was telling him this is incredible. This is incredible material. This is an incredible look. We haven't seen this before. It's not just strong. It's beyond strong. It's powerful. It's moving. It's just more real than anything we've seen in TV coverage, which sounds kind of weird, right? Like, would it be more real? Well, when reporters are involved, sometimes it gets in the way. And by allowing the doctors and nurses and medical staff to tell the story as they saw it, it really removed that wall. And then when we saw the first cuts, it took it to a whole other place. I mean, the team that Mitch had assembled to put together the material we gathered was remarkable. There were technical things we were having to deal with that had never been dealt with before on a network primetime hour. I mean, remember, our broadcast center had been closed. CBS News headquarters was closed. We had colleagues who were sick. One of our dearest colleagues, Maria Mercator, had died from disease just days before. So we were scattered to the four winds as an organization, but somehow Mitch was herding cats and getting the right technical gear to the right people and the right story flow and the right workflow that within 10 days, we pulled this thing together to put on primetime television. I think that's something that is just from a kind of making sausage point of view, totally remarkable.
And I'm glad you included that. And Mitch, I want to get your feedback, because I do think that is one of the notions of that sometimes we do think about the spinning up of coverage in a remote location to cover, as you were saying, Guy, the notion of a natural disaster or something else, where the notion of reinventing the workflow for even the largest of networks because of the dislocation. Mitch, is there anything else that you could kind of lend to the viewers to understand what it was like to virtualize your kind of workflow in such a way to produce this remarkable content?
Well, I know many people watching this have undergone the same thing, whether they're, everybody in broadcasting, certainly, and I'm sure in print too. And we've all faced tremendous challenges that we couldn't have imagined, a year and a half ago. But just as the doctors and nurses in the hospital were dealing with their own improvisation and trying to figure out this strange virus, we were improvising too. It was our goal to have this be broadcast quality, network quality, CBS News quality, with no caveats and no asterisks. We wanted it to look like it had been, edited in our building with our $1 million edit rooms, and all of that gear. But it wasn't. It was done in people's homes, in their kitchens, in their basements. And now that almost seems routine, 18 months in or so. But at the time it seemed, and it was, I think, innovative. We weren't necessarily the first to do it at CBS News. Other shows had done it, 48 hours and 60 minutes, and other shows had done remote editing. And it was all done on the fly. I could tell you that. And I just hope we acquitted ourselves.
Absolutely. So the last question, and it's trying to put work of this caliber in context. And the way that we think about it is awards, any award, let alone awards named for the remarkable journalist Walter Cronkite, in some ways are designed to be beacons to celebrate the process and the product of great work. And you both have spoken a little bit about the decision making that went in to the idea without and long before you could know what the final project would look like and how successful it would be and the impact it would have. So if there's anything, if I can conclude by asking you all to put the work a little bit in context, to say the decision making, especially given the way that we're talking now, that there has been, and both of you described some of the challenges of reporting on suffering and death in these ways. The good and the bad of our public and world now makes suffering more private, and the success of our public healthcare system makes this kind of suffering more private. Is there anything that you could kind of share that might help guide future producers or future reporters into this context of balancing this challenge of wanting to be respectful of suffering, but also provide what both of you described as a deep alternative to the current coverage, but also an impactful and a really meaningful discussion. So, words of advice for folks being inspired by your work.
I think we had a pretty simple instinct, which was to go to where the story was, right? There were societal effects and impacts from COVID, cultural ones, business ramifications, schools, all kinds of things. But we wanted to look at the virus itself, the disease itself, the death and sickness it had caused. And the place to do that was in a hospital. So it didn't take us terribly long to identify that that's what we wanted to do, and to go to where the story was and get inside a big hospital. And we got a little bit lucky, and we got a big important hospital in the middle of the story that let us in. So I don't know that there was anything particularly clever or brilliant in the story's conception, but things just lined up. Things lined up, and often a key thing in journalism is access, and we got access, and we got access with the right team, with Guy and the others who were in and around the hospital, and it came together, and it was timing and a few other things and a little bit of luck and a lot of experience and skill, and we were happy with the result, and apparently the USC was as well, and we're really honored, really honored to have won the Cronkite Award.
Getting to the truth is hard. It's hard work, and that's what we all aspire to do, is get to the truth of things. It's what Cronkite did throughout his long career. It's the tradition at CBS News. It's what we aspire for every single day. And this was a situation where things lined up. The risk ultimately was worth it, because our hope is that years from now, people can look at this and maybe truly understand in a way that's more profound about what those early weeks were like when the great COVID pandemic swept across the world and settled here in the United States.
So thank you, Guy and Mitch, and congratulations to the entire CBS News team for an incredibly impactful and important work. Congratulations.